The Research Facilitator Scheme aims to improve the care for our patients and their families by improving and increasing the knowledge base that our clinicians and those that are caring for our patients have. So by better understanding needs, we can meet those needs, and research is one of the ways of increasing the evidence base of why something works or why something doesn't work.
So the aims of the Research Facilitator Scheme include engaging hospice staff in research, and this could be through numerous ways, for instance by developing a seminar series within the hospice, so staff become more aware of research and get the opportunity to engage in research discussions, through dissemination of new research findings through research newsletters, and by offering staff the possibility to discuss research findings in various forums. Part of the scheme also involves linking with our local academic institutions to develop and design new research proposals that will help meet the needs of our patients and their families, and to apply for funding for these proposals.
As a research facilitator, I see my role as having three main elements to it. An internal role within the hospice, where I'm based with my clinical colleagues and the management teams within the hospice. Secondly, out with external partners who we can't do the research without. So these include our academic colleagues who we're building up relationships with depending on their expertise and their interest in end-of-life care. Also with other hospitals and community posts. So what we're trying to do within the West Midlands is to increase the capacity of what we can do together in a synergistic way, more than each one of us can do separately. And thirdly, I work with Marie Curie as an organisation itself to ensure that we communicate with our colleagues, other facilitators based in other hospices in other parts of the country, and the Marie Curie London-based teams, but also the units that are funded through the research activities, such that together we're not repeating what's already done, we're learning from each other, we're taking best practice, and therefore we can move towards the outputs of research quicker than we would if each one of us was working in a vacuum by ourselves.
So we've just received funding for a project to identify and support the needs of informal carers of patients that are approaching the end of life. So this is a piece of work that we will be doing in collaboration with Professor Scott Murray at the University of Edinburgh. And as part of that project, we will be developing a new intervention that will help identify carers of patients towards the end of life in a primary care setting. At the moment, it is very difficult for us to identify carers and to know who carers are. Often carers themselves don't self-identify and see themselves as family members more than carers, so they may not be aware that they may have additional needs or that they could benefit from additional support. So as part of this project, we will be conducting a number of qualitative interviews and focus groups with various types of carers. For instance, spouses of people who are approaching end of life, adult children of people approaching end of life, patients themselves who will also have a particular view about their family members and the caring responsibility of family members, as well as the professionals involved in looking after patients as well as carers. Carers themselves often have additional stresses and strains which may require them to access support from their GPs. So if we can help identify these people in advance, it will allow us to better support them.
Investment for end-of-life care and palliative care research is so important because it's an under-resourced area. It's been neglected, and a lot of practice, clinical practice, is based not on strong clinical evidence, and in order to change this, we need to continue to build the momentum, build the capacity in our research community, working with our academic colleagues, working with our clinical colleagues based at acute hospitals, based in our hospices and out in the community. And that will really make a difference in the longer term. I think we realise that research is not a quick fix. It has to have appropriate methodology, it has to ask the right questions, it's got to involve our patients, have the right partners and teams to ensure that what we produce is it can stand on its own 2 feet and can therefore impact and make a difference to how we actually carry out clinical practice. If we stop in funding now, then that momentum will be lost and those questions won't be asked, and we'll be letting down our patients and their carers in the longer term.